Isatuximab VRd treatment combination that has been recently reported in the New England Journal of Medicine, and a modification of the same combination reported as the benefit trial in the Nature Medicine publications are both crucial treatment improvements for newly diagnosed transplant-ineligible patients. In the UK, we're really excited that this treatment combination is going to be looked at by NICE in the next few months. And this really would be a step change with what we're currently offering for newly diagnosed transplant-ineligible patients. We currently offer daratumumab in combination with lenalidomide and dexamethasone. And what we have seen with the Isatuximab VRd trials is the proportion of patients who get deep responses is significantly augmented by an additional 20%. This could really mean a critical difference, particularly for the elderly myeloma patients whose probably a key therapy will be just a frontline therapy because their ability to tolerate and be able to receive subsequent lines of therapy is limited. So the ability to give a much better treatment for these patients in the newly diagnosed setting really excites us, and we hope that we're going to be able to have the ability to do so for patients in the UK.